Today we're going to dive into blood urea nitrogen to creatinine ratio, which is essentially measuring the concentration within a blood sample to assess and monitor kidney function. Hi, my name is Dr. Arianne Missimer. I'm a functional medicine practitioner, doctor of physical therapy, registered dietitian, owner of the Movement Paradigm Integrative Health Center, and I am a medical educator for Rupa Health. So let's start with blood urea nitrogen. So essentially this is a waste product that is coming from breakdown in the liver. So proteins are typically metabolized into ammonia, converted to urea, and excreted by the kidneys. So urea nitrogen is a waste product that's made when your liver breaks down the protein. It's carried in the blood, it's filtered out by the kidneys and removed in your body via urine. So that's one of the ways that we detoxify. So if your liver isn't functioning optimally, it may not break down the proteins the way that it should. If your kidneys are not functioning properly, then that will not filter the urea. And so either of these problems could lead to an increased amount of urea nitrogen in the body. So this is going to be influenced by protein intake, hydration, metabolism, liver function, and kidney clearance. So what might affect these levels? So a high protein diet can, steroid use, dehydration, burn injuries, and aging all could influence this, which is why it's really important to utilize this test along with creatinine to make sure that you're really assessing kidney function properly. So why might you order the blood urea nitrogen test? Symptoms that may be associated with kidney problems could include things like needing to urinate more or less often. That's definitely a big red flag. Joint or bone pain, muscle cramps. One common thing that so many of our patients experience is restless legs, fatigue, itchiness, swelling in the arms or legs, and many people with kidney problems do not experience symptoms right away. So sometimes this biomarker early on can really be very helpful to help us really understand what to do with this. So creatinine is a waste product that comes from muscle metabolism, specifically from creatinine phosphate breakdown. So it is a normal process, but it is filtered and excreted by the kidneys at a pretty constant rate. So it's a really reliable indicator of assessing kidney function, and high levels suggest impaired kidney function or decreased glomerular filtration rate. So this essentially is a calculation used to estimate how well your kidneys are filtering certain agents. So what might affect the creatinine levels? Certain medications, so things like Tagamet, NSAIDs, chemotherapy drugs, certain classes of antibiotics such as cephalosporin, all can impact the results. Also, eating large amounts of protein following a vegan or vegetarian diet can temporarily increase creatinine levels. Recent high-intensity exercise and other factors such as age, sex, body size, muscle mass, pregnancy, kidney problems, and dehydration. So there's a lot of things we want to factor in if there is a abnormal level that we can either really begin to ask questions or also retest as well. So why might you order the test? Some symptoms that your patients might complain of would be swelling in the hands or feet, puffy eyelids, dry, itchy skin, numbness, fatigue, increased or decreased need to urinate, urine that is bloody or foamy, loss of appetite, weight loss, muscle cramps, shortness of breath, sleep problems, nausea and vomiting, and trouble thinking clearly. So if you also have a high risk of developing kidney disease, this is a really important biomarker to monitor, and it can really be helpful in the early stages of kidney disease. So if your patients have high diabetes, high blood pressure, if there's a family history of kidney disease, diabetes, or high blood pressure, if there's heart disease, if someone is over 50 years old, if they smoke or are obese, all of these would indicate that this is a really important biomarker because they are going to be at high risk for developing kidney disease. And it's also a really great marker to monitor kidney disease over time or any type of kidney issue. So if there is an abnormal result in the past, that would indicate that you want to continue to monitor. If you've been diagnosed with kidney disease or you're taking certain medications that are affecting your kidneys, or you've had a kidney transplant. So now let's get into the blood urea nitrogen creatinine ratio. So it provides insight into kidney function and hydration status. It helps to distinguish between pre-renal, renal, and post-renal causes of acute kidney injury. And although it may not accurately reflect early kidney disease, it is really helpful for monitoring significant changes in kidney function over time. And it's used along with the eGFR for a comprehensive assessment. So the testing methods are quite simple because it is a blood test, it's part of a CBC, and ideally our patients should fast for 8 to 12 hours, and is measuring the BUN, blood urea nitrogen, and creatinine. And the ratio itself is calculated by dividing blood urea nitrogen level by the creatinine level, both in milligrams per deciliter. And the reference range is going to be between 10 and 20 for adults, but it may vary among labs. You just want to make sure you take that into consideration. So when we're interpreting the results of this, we're looking at a 10 to 1 up to 20 to 1 ratio, which is going to indicate balanced kidney function and hydration. A deviation of this can suggest kidney dysfunction, dehydration, or even heart failure. And we've already spoken about this, but it can be influenced by non-renal factors. So that's why it's really important, as always, to do a comprehensive functional medicine evaluation. So what does a high BUN creatinine ratio mean? So this can have several implications for health, including impaired kidney function, dehydration, which we've already spoken about, acute kidney injury, chronic kidney disease, congestive heart failure, urinary tract obstruction, hyperthyroidism, significant GI bleed, and high protein intake. What does a dangerously high BUN creatinine ratio indicate? So this typically means that there's a severe kidney impairment or other serious condition, and this would really warrant further investigation. Although there's no universal threshold, the ratio above 20 to 1 is definitely considered abnormal, and we would want to look at all of the other individual factors like age, gender, medical history, diet, and lifestyle, but make sure that further testing is indeed part of this. What does a low ratio mean? So this can indicate reduced protein intake, which is very common, liver disease, malnutrition or starvation, pregnancy, and severe muscle wasting. So what is the clinical significance and management of this? So again, if we're thinking of that high ratio, it can indicate that kidney dysfunction or extrarenal causes like dehydration or GI bleed. So we may need to really look at other root causes, further testing and medical evaluation to see what this is and how we can manage it. Treatment is going to focus on addressing the underlying condition. So that could be anything from fluid replacement to medications to even dietary changes for kidney disease. And also regular monitoring of kidney function is crucial to assess treatment effectiveness and adjust the approaches accordingly. So in summary, the BUN creatinine ratio can be an extremely valuable biomarker to assess kidney function. It is something that's very easy that we can include in our CBC recommendations for our patients, and it is also something that we can monitor very easily over time. So I hope that this was helpful for you today. If it was, please make sure to subscribe to our YouTube channel for more videos like this on root cause medicine.
Hey, thanks for watching our video. If you order lab tests for your medical practice, head over to rootbout.com to order hundreds of different labs from over 35 different lab companies, including Dutch, Dr. Zeta, Mosaic, and more.